Hi, I'm Donnell King. I'm a nurse practitioner at Riverway Clinic in Elk River.
My name is Jamie. I am a certified medical assistant at Riverway Elk River.
We wanted to talk a little bit today about collaborative documentation, how it's changed not only my practice but also Jamie's practice. One of the benefits I have seen is it's made my documentation more effective, and my time with patients has been more efficient as well.
For the practice for the medical assistants and rooming patients, it has allowed us to become more engaged with the patients when we're rooming them. Also, the agenda setting has definitely allowed us to spend a little less time on medications and go through that a little bit faster. And the only thing you might notice is it might seem like rooming time might be a little bit longer than usual, but actually it's allowing this agenda setting and collaborative documentation is allowing for us to get out earlier at the end of the day. And like I said, the medications really allow you to go through the meds faster. So
one of my fears when this rolled out was actually the agenda setting. It's always the fear of a provider when they have all the extra add-ons of how is this going to work. But what I found is when patients check into the office, they're handed the sheet of paper, they write down why they're here today, and then also, if we have time, other issues they would like addressed. One thing I found when the time they're roomed is those issues that are extra have already been addressed or started in evaluation on, so I have time before I go into the room to look things up. I'm able to look at a little bit of history, and so my time there is really more focused on the patient than what it is looking back through their chart for those extra things. The other thing I found is I used to go home at night and do charts. I would do charts in the morning before I get to work, and I found that by the time I leave work, my charts are actually closed and done for the day. All of my notes are started, and it's very helpful as far as recalling different conversations with the patient. Collaborative documentation has been a benefit for me as far as my notes being documented and completed in a timely fashion. My nurse, Jamie, she will start the note for me, and I have information that I then don't have to re-ask the patient, so it makes my time with the patient more focused on them and more efficient. And then when I go to complete my notes, I try to do it at time when they're there or shortly after their visit, but if I can't, I'm able to refer back to the information that I don't have to recall at a later time, so it makes my time completing the note much more efficient. And most often, I walk out the door at the end of the day, my notes are completely finished. Some things to think about as you integrate this into your practice would be starting slow. Pick one or two topics, whether or not it be routine health maintenance, diabetes, anxiety, depression, and really focus on those and get good at working those templates before adding new templates to your practice.
as a rooming assistant, when you first start using the collaborative documentation, you definitely should discuss with your provider what you expect out of it, what the tool you're going to do to determine which template you're going to be using at that time. Also, it is a learning curve, so when you first start using the collaborative documentation, it's going to take you a little bit more time in the room, but as time goes on, you realize that you just get used to it. It is just a second nature, and that your time will speed up again.